Hello. Thank you for your interest in the Adolescent Vaccination Program and for taking time out of your busy schedules to view this training video. We are excited to have you on board as AVP Champions for your clinic. My name is Mary Healy and I'm an Associate Professor of Pediatrics, Infectious Diseases at Baylor College of Medicine and Texas Children's Hospital in Houston, Texas. I'm a collaborator on the Adolescent Vaccination Program and I'll be hosting this webinar today. Despite increases, coverage estimates for human papillomavirus or HPV vaccine remain low and continue to lag behind rates for the Tdap and quadrivalent meningococcal conjugate vaccines. For this reason, the goal of the Adolescent Vaccination Program is to increase HPV vaccination in pediatric clinics. To facilitate this improvement, we developed the Adolescent Vaccination Program Implementation Tool, or AVP-IT, to help you and your clinic implement 6 HPV vaccination strategies that have been demonstrated effective in increasing clinic vaccination rates. In this webinar, I'm going to provide a quick overview of the Adolescent Vaccination Program strategies and your role in implementing these strategies in your clinic. The first strategy is identifying an AVP champion, which is the role you've agreed to. Your first task as AVP champion is to obtain a tailored action plan for your clinic. You can do this by going to the My Action Plan tab on the AVP-IT homepage and completing the 12-item action plan wizard. The action plan provides tailored recommendations for implementation of the AVP strategies to increase HPV vaccination. We recommend that you introduce the AVP to clinic personnel within 2 weeks of launching the program. This orientation is best given to the entire clinical team involved in immunizations, including physicians, nurses, and medical assistants. Next, follow the AVP action plan to implement AVP strategies in your clinic. It's important to implement strategies as described in the action plan. The AVP is demonstrated effective in increasing HPV vaccine initiation and completion rates when all strategies are implemented in the way described in your action plan. These results aren't guaranteed if a piecemeal approach is taken to a selection of strategies or if they're implemented in ways other than described. The 5 remaining AVP evidence-based strategies include provider assessment and feedback, the AVP continuing education training, electronic health record or EHR provider prompts, parent reminders, and parent education delivered through the AVP HPV Cancer-Free app. As you know, vaccination is a complex issue with many layers, which is why we must address it from both the provider and patient levels in order to see improvement. The next strategy is provider assessment and feedback. Assessment and feedback refers to assessing provider and clinic vaccination rates and giving feedback about goals for improvement. The Community Preventative Services Task Force recommends routine assessment and feedback for providers as one of the most effective strategies for achieving high, sustainable vaccine coverage. Based on our experience implementing assessment and feedback in clinic networks in Texas, we recommend that reports be provided on a quarterly basis and that both physicians and clinical staff involved in vaccinations receive these reports. As AVP Champion, you will need to ensure availability of IT resources to perform data pulls on a quarterly basis. The A&F Data Guide, which you can find in the Tools section of your action plan, lists all the data elements you'll need to develop your clinic's A&F reports. Run the query every quarter to extract this data specific to each physician in your practice. If you're not familiar with extracting data from the EHR database, identify someone else in your clinic who can take on this task. Once you have the data, use the A&F report template in the Tools section of your action plan to create individual feedback reports for each physician in your practice and a clinic level report for other clinic staff involved in vaccinations. Open the A&F report template and click on the Data Entry tab at the bottom. Then enter the data for each physician in your clinic. Once the data has been entered, click on the Clinic Report and the Physician Report tabs at the bottom to view the A&F reports. Next, print and distribute the A&F reports to physicians and clinical staff in your clinic. In the next few slides, I'll walk you through the different components of the AVP A&F reports. The clinic report contains clinic-level data only. These reports should be distributed to advanced practice providers, clinical staff, and the practice manager. The clinic performance table at the top summarizes HPV vaccine initiation and completion rates among eligible patients seen by all physicians in the clinic. Patients are eligible if they are between the ages of 11 and 17 and were seen by any physician during the quarter. This graph shows HPV vaccine initiation and completion rates among patients of each physician in your clinic. The blue bars represent the percent of 11 to 17-year-old patients seen by each physician in your clinic during the quarter who have ever received a first dose of the HPV vaccine. And the orange bars represent the percent of 11 to 17-year-old patients seen by each physician in your clinic during the quarter who have ever completed the HPV vaccine series. The physician report has 2 pages. The first page contains individual physician level data and the second page contains clinic level data. The A&F report template will generate a separate report for each physician in your clinic. The physician performance table at the top summarizes HPV vaccine initiation and completion rates among eligible patients. Patients are eligible if they're between the ages of 11 and 17 and were seen by the physician during the quarter. The graph shows adolescent immunization coverage of patients served by the individual physician receiving the report during the quarter. The blue bar represents the percent of 11 to 12-year-old patients seen by the physician during the quarter who have ever received a first dose of the HPV vaccine. The orange bar represents the percent of 11 to 17-year-old patients seen by the physician during the quarter who have ever received a first dose of the HPV vaccine. The green bar represents the percent of 11 to 17-year-olds seen by the physician during the quarter who have ever completed the HPV vaccine series. And the yellow bar represents the percent of 11 to 17-year-old patients seen by the physician during the quarter who have ever received Adolescent Tdap and MCV4. The second page of the physician report contains the same clinic-level data from the clinic report, including the clinic performance table and graph of HPV vaccination rates among patients of each physician in your clinic. The next strategy is the AVP Continuing Education Training titled Optimizing HPV Vaccination, Improving Communication Through Ethical Principles and Evidence-Based Clinical Strategies. You'll find that this training explores HPV vaccination from a new angle, drawing from medical ethics and case scenarios to empower clinicians with the communication skills they need to promote HPV vaccination as a tool for cancer prevention. It covers 1. How the principles of medical ethics apply to HPV vaccination. 2. The real and rising burden of disease associated with HPV infection. 3. HPV vaccination guidelines and coverage. 4. Clinical strategies at a system, clinic and individual level that will help improve HPV vaccination rates. And 5. Effective strategies to improve communication with parents about HPV vaccination. This is a free activity and participants will be able to earn 1 hour of Ethics CME or CNE credit. As AVP Champion, you will notify staff in your clinic about the AVP Optimizing HPV Vaccination Continuing Education activity. The continuing education is suitable for all clinic staff involved in immunizing adolescents, including physicians, nurses, and medical assistants. Providing the same information to clinic staff at all levels about the HPV vaccine, communication strategies, and available resources ensures that all staff are comfortable with the vaccine and deliver a consistent message to the families you serve. The Tools section of your action plan contains resources to promote the AVP continuing education in your clinic, including a flyer and a sample email to staff. Make sure you note that the activity is an easy way to obtain Ethics CME or CNE credit. Next, set up a timeline for completion. While this can be negotiated, research results indicate it is best to complete the training for all clinic personnel within a 30-day period. This promotes the cultural shift towards increasing HPV vaccination and is easier to monitor. Instructions to access the continuing education online are provided on the AVP CE flyer. However, more detailed instructions will also be provided in your clinic's action plan, so you can assist in any troubleshooting. Finally, ensure that all clinic staff and new members complete the continuing education. The Tools section of your action plan provides an AVP continuing education tracking or sign-off form that can be used to track staff participation. The form can be provided to the clinic team at huddles or mounted on a notice board. For continuity of the AVP initiative, we also recommend that you provide the continuing education to new staff as part of their onboarding protocol. The next strategy is Provider Prompts, which lets providers know when patients are due for HPV vaccination. We know from our work that Provider Prompts in the EHR is a valuable strategy for aiding providers in HPV vaccination. Since the 2 or 3 dose administration schedule of the HPV vaccine presents extra challenges compared to other adolescent vaccinations, these alerts will be instrumental in helping your clinic identify patients who are due for their first or follow-up doses of the vaccine. The first step is to work with your EHR vendor and learn if or how EHR-based provider prompts for HPV vaccination can be configured for your practice. Many EHR systems provide built-in reminder functions, such as best practice alerts or health maintenance. These functions are adjustable to trigger based on HPV vaccine eligibility. If your EHR system has this functionality, ensure the availability of IT resources to set up the Ehr Provider Prompts. If automated EHR-based prompts are not possible, consider using an alternative approach to notify providers that patients are eligible for their HPV vaccine, such as constructing a report of eligible patients. This report can be run manually at specified intervals and the results delivered to those managing the provider prompts delivery. An office staff or clinical team member can then place a note in the patient's electronic chart. Clinics without an EHR can implement the traditional approach of placing notes or stickers on the patient's paper chart. Of course, as you know, patients and families play a huge role in vaccination as well. The next strategy is parent reminders, which let parents know their child is due for HPV vaccination and they should set up an appointment. Because after all, it's impossible to vaccinate a child who never walks through your door. Reminders are delivered through various channels, for example, telephone, email, letter, postcard, or text message. They may be tailored for individual patients, and they may include educational messages about the importance of vaccination. The first step is to work with your EHR vendor and learn if and how EHR-based parent reminders for HPV vaccination can be configured for your practice. If automated EHR-based parent reminders are not possible, consider using an alternative approach to notify parents, such as constructing a report of eligible patients. This report can be run manually at specified intervals, and then phone or mail reminders can be delivered manually by office staff. Another approach to maximize completion of the HPV vaccine series is to ask families to fill out reminder cards for follow-up doses, for example, dose 2 or 3 of HPV vaccine when in the office. The final strategy is the AVP Parent Education App called HPV Cancer Free. This self-administered app was designed to raise awareness of HPV vaccination, reduce barriers to HPV vaccination, and enable parents to schedule HPV vaccination reminders through their smartphone. In the next few slides, I'll show screenshots of the different features available within the HPV Cancer Free app. Keep in mind that each screenshot only shows some of the information presented on that page. The app homepage has a 60-second video that summarizes some of the important information about HPV and the HPV vaccine that you'll find in the app. It also has an About Us section with information on the app and the collaborating institutions who partnered to create the app: UT Health School of Public Health and Baylor College of Medicine. HPV Cancer Free contains 4 self-tailored features which address specific modifiable barriers and facilitators of HPV vaccination for parents. 2 of the features provide parents with education about HPV and the HPV vaccine, and the other 2 facilitate communicating with the child's pediatrician and scheduling vaccination reminders. HPV A to Z provides education about 9 topics related to HPV and the HPV vaccine. Parents can select any topic they're interested in any order. It's completely self-tailored. Each of the 9 modules provides education through text, graphics, and external web links to reputable sources such as CDC and National Cancer Institute if the parent would like to know more. Bust a Myth addresses common misconceptions about the HPV vaccine, such as whether the vaccine is necessary for your child and whether your child is at risk for HPV. This feature is also self-tailored. Each module contains 3 collapsible sections. 1. The Facts, which provides accurate, factual information to bust common myths. 2. Straight from the Doc, which features real pediatricians who refute these misconceptions and encourage parents to vaccinate their children. And 3. Parent Perspectives, which features real parents of adolescents who share their stories and experiences surrounding each myth. Notes for Doc provides a space for parents to record questions they would like to ask their child's pediatrician during their next visit. This feature is accessible both from the navigation bar at the bottom and from each of the educational modules in case something they learned brings up a question they don't want to forget. There's also a space for them to record the doctor's answer to their question. Get the Vax allows parents to schedule reminders for HPV vaccination appointments as well as follow-up doses. Parents can choose to have a push notification reminder sent to their phone after entering their appointment information. They can also receive push notifications to remind them to schedule appointments for follow-up doses when their child is due for the next dose. As AVP Champion, you will notify staff in your clinic about the AVP HPV cancer-free app. Make sure you notify all clinic staff involved in vaccinations, including physicians, nurses, and medical assistants. The Tools section of your action plan contains resources to promote the app in your clinic, including flyers and a sample email to staff. Post the flyers in your clinic's waiting room and exam rooms. Also, encourage clinic staff to recommend the HPV cancer-free app to parents of 10 to 17-year-olds who have not initiated or completed the HPV vaccine series. Finally, you will train clinic staff to provide instructions to parents on how to download and use the HPV cancer-free app so they can assist parents in any troubleshooting. Thank you for taking the time to view this training. Our AVP-IT team is available to you should you have any questions about implementing these strategies in your clinic. Please send your questions to Adolescent Vaccination Program at uth.tmc.edu and one of our team members will get back to you.